Picture this. Your patient is lying inside the MRI scanner, undergoing a routine scan. They're enclosed within the powerful magnetic field, a silent force that's both essential for the imaging and potentially hazardous. The room is quiet, save for the rhythmic thumping and whirring of the machine as it captures detailed images of their internal organs. Everything seems to be proceeding as planned. But suddenly, without warning, the steady rhythm of the heart monitor falters. The beeping slows, becomes erratic, and then flatlines. They're in cardiac arrest. A wave of panic washes over you as you realize the gravity of the situation. Every second counts. Your immediate instinct is to rush in with the crash cart, the lifeline in such critical moments. You envision yourself grabbing the defibrillator, preparing the oxygen, and initiating the life-saving procedures you've practiced countless times. The urgency is overwhelming. But then you freeze at the door, your hand hovering over the handle. A stark realization hits you, stopping you in your tracks. The powerful magnet inside the MRI scanner, the very core of the machine, makes bringing in any metal equipment a potentially deadly decision. It's a silent, invisible threat that can turn ordinary objects into dangerous projectiles. The tools you desperately need, the very instruments designed to save a life, defibrillator, oxygen tank, all containing metal components, could become lethal projectiles, drawn in with tremendous force by the magnetic field. They could strike the patient, the machine, or even you with devastating consequences. Remember, the magnetic field is always on, a constant and unwavering presence. The magnetic force is relentless. So, what is the right move? What is the appropriate course of action in this high-pressure, life-threatening situation? The key is to move the patient carefully and swiftly out of the immediate range of the magnetic field. This is the first and most crucial step. Only then, once the patient is safely removed from the magnetic field's influence, can you begin any life-saving interventions with the necessary equipment? Slowing down is paradoxically the fastest and most effective way to ultimately save a life in this challenging environment. In the following scenes, we will delve deeper, breaking down the underlying technology of MRI scanners, exploring the specific risks they pose. MRI stands for magnetic resonance imaging. It's a mouthful, but the technology behind it is truly fascinating. We're going to break down what it is and why it's such a valuable tool in modern medicine. It's a powerful, radiation-free way to see inside the body. Unlike X-rays or CT scans, MRIs don't use ionizing radiation, making them a safer option, especially for repeated scans or for vulnerable populations like pregnant women and children, when deemed medically necessary. It uses strong magnets and radio waves to create detailed images. The magnetic field aligns the water molecules in your body, and then radio waves are used to disrupt this alignment. When the molecules realign, they emit signals that the MRI machine detects and translates into images. It's especially effective at imaging soft tissues like the brain, spinal cord, nerves, and muscles. This is where MRI really shines, providing clarity that other imaging techniques often can't match. The level of detail allows doctors to diagnose a wide range of conditions. Doctors order MRIs for a variety of reasons, including suspected strokes. The rapid and detailed imaging capabilities of MRI are crucial in stroke diagnosis and management. They are also used to detect tumors, providing valuable information about their size, location, and characteristics. This information is vital for treatment planning and monitoring. MRIs are frequently used to assess joint injuries and more. From torn ligaments to cartilage damage, MRI can visualize the intricate structures within joints with remarkable precision. They are ordered when doctors need a level of detail other scans like X-rays can't provide. While X-rays are great for visualizing bones, MRIs excel at showing soft tissues, making them indispensable for diagnosing many conditions. For example, an MRI can spot a stroke within minutes of symptom onset, allowing for rapid intervention and potentially minimizing long-term damage. This speed and accuracy are critical in emergency situations. It can also reveal a hidden tumor, even in its early stages, when treatment is often most effective. Early detection is key in improving outcomes for many types of cancer. Educate and reassure anxious patients who may be apprehensive about the procedure. Explain that the scan is painless, though it can be noisy and feel confined. Preparing them for these sensations can significantly reduce their anxiety and improve their cooperation during the scan. Now let's delve deeper and look at how MRI technology actually works. MRI works by aligning the protons in your body's water molecules using a strong magnetic field. A pulse of radio waves knocks these protons out of alignment. As they realign, they emit signals detected by the scanner. Different tissues emit different signals, allowing the computer to create detailed images. The loud noises during a scan come from coils rapidly switching on and off to localize the signals. This process gives us clear 3D images, without any radiation. Now let's talk about contrast agents. Sometimes doctors need even clearer images, so they use a contrast agent, usually gadolinium. Injected into the bloodstream, gadolinium makes certain tissues and blood vessels stand out on the scan. It's especially useful for spotting tumors, inflammation, or vascular problems, but gadolinium isn't for everyone. Patients with poor kidney function are at risk for a rare, serious condition called NSF. Always check for kidney disease and review recent GFR lab results before administering contrast. If kidney function is low, gadolinium may be contraindicated. Now, let's explore MRI safety zones. Safety starts before you even enter the scanner room. MRI suites are carefully designed environments, and to ensure the safety of everyone inside, they are divided into 4 distinct safety zones. Understanding these zones is absolutely crucial for all personnel, especially nurses, who play a vital role in patient care and safety within the MRI environment. Each zone has progressively stricter rules and regulations as you get closer to the powerful magnet at the heart of the MRI system. These rules are not arbitrary. They are in place to minimize risks associated with the strong magnetic field and radio frequency energy emitted by the machine. Zone 1 is designated as public areas, such as waiting rooms and reception areas. In this zone, there are generally no specific restrictions related to MRI safety. Patients and visitors can move freely without needing special screening or precautions. Zone 2 is the screening area, often located near the entrance to the MRI suite. Here, patients are required to change into appropriate attire, typically a hospital gown, to eliminate any potentially hazardous metallic objects. They also undergo a thorough screening process, which includes completing detailed safety questionnaires. This helps identify any contraindications or potential risks associated with the MRI procedure. Zone 3 is the control room. Access to this area is strictly restricted to trained and screened staff members who are responsible for operating the MRI equipment and monitoring patients during the scan. Zone 4 is the scanner room itself. Inside this room, the powerful magnet is always on, generating a strong magnetic field. Therefore, only MRI-safe equipment and thoroughly screened people are allowed to enter. This means that all items brought into the room must be certified as MRI compatible to prevent them from becoming projectiles or interfering with the imaging process. Absolutely no metal objects, including stethoscopes, pens, and IV poles, can enter Zone 4 unless they have been specifically certified as MRI safe. Next, let's review what to do in the event of an MRI emergency. If a patient codes in the MRI scanner, do not bring metal equipment into Zone 4. First, stop the scan and use the scanner table to move the patient out of the magnet. Transfer them onto a non-magnetic stretcher with no metal equipment. Move the patient into Zone 3 or 2 before starting resuscitation. Only then can you use the crash cart and defibrillator. Remember, move the patient to the equipment, not the equipment to the patient. All code team members must know this protocol. In extreme cases, the magnet can be quenched to shut it down. But this is dangerous, and only for life-threatening emergencies. Your role in MRI safety starts before the scan and continues after. Pre-screen every patient for implants, metal fragments, or contraindications. Ensure IV access is ready if contrast is needed. Educate and reassure the patient, addressing fears and explaining the process. Offer ear protection and sedation if needed. During the scan, monitor the patient's vital signs with MRI-compatible equipment. Watch for distress or complications and communicate with the technologist. After the scan, check for reactions to contrast and assess the IV site. Monitor sedated patients until fully awake. Provide post-scan instructions like hydration,